Hello and welcome to VetPhysioLife, episode 13. I'm Shailen Chisani and I'm joined as always by Kim Sheeder. Hi, Kim.
Hello.
I think you've had a slightly tiring but good weekend, is that right?
Yeah, that's probably a good way of putting it. Pretty shattering, but it was very exciting and very interesting. Yeah, definitely.
Cool, because on the episode that we did on Friday, we mentioned that you were going on a canine chiropractic course this weekend.
Yeah.
I'm just going to, try and take a step back and shut up and let you tell us all about why it was so amazing.
It's just it was really interesting from my point of view. It was a lot. There was a lot more to it to chiropractic than I'd appreciated, which I did say that might be the case. It was very interesting. They actually have quite a sort of nerve-based physiological approach to how they're and why they're doing what they're doing. So it gets quite technical and quite it's down to physiology and nerves and things and reactions in joints. But it was really interesting, and it was very interesting in that it was their assessment techniques are different but very similar to what we as physios already do, but their treatment techniques and their clinical reasoning behind it were quite different, but in a good way that can be used as an adjunct to what I already do. So it hopefully, with a bit of practice, because it is going to take some practice, it will be a really useful addition to my treatment toolbox per se. Very interesting. Yeah, it was great. Really good.
Fantastic. So I guess if you could just give us a little bit of an overview of what the course involved, because it was 2 days, wasn't it?
Yeah, so it was 2 days. It was just concentrating on manipulation or adjustment, as the chiropractors prefer to call it apparently, of the pelvis and the lumbar spine, so the base of the spine, lower back, and looking at what happens and how to assess it and how to then treat and adjust the spine and pelvis. So it was really interesting. It's again, they start in very similar ways to us as physios. They look at gait analysis and look at how the dog is moving, palpate to see what's happening with the muscles, which muscles are working too hard, which muscles aren't working hard enough. But they have different techniques for switching on and switching off those muscles, and that's part and parcel of the adjustment of the bones and the joints. So it will be really interesting to add in. So it's the sort of thing that I can use. So once I've done my normal assessment that I would normally do, if I've got a dog that has got, for whatever reason, a usual pattern in the back end for whatever problem is, that say they've got their hip flexors, so the muscles that bring their leg forwards, the back leg forwards, are working too much and are switched on too much. You can use adjustment techniques to tone those muscles down and get them to relax a bit more, which I can then use in conjunction with my soft tissue release and the other things I would do, so that when I then get them doing exercises and get them moving again, they would be even more effective, and the muscles can relearn how to move properly. Because that's a lot of what we're trying to do, is by restoring function, what we're trying to say is getting the dog to move in the most efficient and the best way possible, which is the best function possible. And dogs and cats are great in that if you take away their soreness or their muscle tightness and their pain, and then help them move in the correct way, they tend to stick to continuing to move in the correct way rather than drifting back to bad habits, which is sadly what a lot of humans end up doing for one reason or another. So yeah, quite interesting.
And why was it focused on the pelvis and the lumbar spine? Are those kind of two key areas, or?
It was just purely and simply somewhere to start, in all honesty. So we are, having done this weekend and it's been so successful, we're hoping that we're going to be able to then arrange possibly 2 further weekends, one on the thoracic, so the rib cage, the thoracic spine and the cervical spine, so the neck, and then a further one on the peripheral joints, so we can see how those are all treated as well. But it's just too big a subject matter, and there's probably more. If physios and chiros looked at their caseloads, you probably have a few more back leg, hind limb problems than you do front limb problems. So it was a good place to start because we've probably got a bigger caseload of those.
Cool. And in terms of, you're saying about maybe incorporating some of what you've learned into your practice.
Yeah.
I guess you're not saying, you've become a chiropractitioner. Is that the right word even?
Chiropractic, yeah.
You've become a chiropractic by going through one course. So what is the kind of regulations around, introducing new techniques, learning? Do you need any sort of certification? Like, how does that kind of work?
So we've, so obviously we will get CPD hours because every physio has to maintain a certain amount of CPD, which is continuing professional development, and we have to do 50 hours over 2 years, however that is spread. So, and we have to at least a minimum of. The majority of us do a lot more than that. I definitely do, so that will contribute towards that. The difference is no, a chiropractic course to become a chiropractor is usually years, and certainly a lot of months at the very, very least. But the difference is, as physios, we've already got the palpatory skills and the underlying biomechanics knowledge, physiology knowledge. So a lot of the underlying principles of what we learned this weekend were things that were already familiar to us. And it was more about learning that technique. So we spent a lot of time practicing on, first of all, on ourselves and each other, as in learning the right pressures to use, the right handholds to use, et cetera, and practicing the actual, the speed of the technique, because in actual fact, the adjustment is more about how quickly you do it rather than how hard. You don't want to do it hard, you want to do it fast.
Right.
Is the golden rule, which we've learnt. So practicing that on sort of ourselves and each other, and some stuffed dogs that were, so stuffed toy dogs that have got sort of wired joints in them, so you can have a little practice. And then we had some real dogs come in so we could palpate them, see what we thought, and then towards the end of the weekend, actually treat those dogs between us and hopefully help them with what we've found. So it's because of our backgrounds as physiotherapists, you're able to jump a lot further forward than just someone who doesn't have all that background knowledge, which could be anyone from a normal layperson to even a vet, because how we as musculoskeletal practitioners palpate a dog's muscles and joints is actually very, very different to how a vet is taught to palpate them. So it's learning the subtleties that can take the time and actually listening to what your fingertips are telling you, whereas we as physios have already been doing all of that. So it was more about learning the underpinning reasons for it and actually the technique itself. So that was why we could do it in just 2 days rather than the length of time it takes normally. Having said that, no, we're not chiropractors. It will just be, we are now able to adjust as well as, or manipulate a lumbar spine and a pelvis, and it's only the lumbar spine and the pelvis that I would manipulate at this moment in time, as well as mobilise it. which was what we were talking about, what I was explaining last week.
And so, how did you find it? Because you were saying when we talked on Friday about, it's a grade 5 and it's sort of a kind of quick all-in-one and all that sort of stuff. Did you find it a little bit worrying? Were you a bit scared about doing it, or?
Yeah. I think all the physios that were there were about 10 of us there, and we were all absolutely petrified to start off with. But the more we sort of watched it being done, observed it, tried it on ourselves, and then actually did it to the dogs, you actually realise that it's nowhere near as scary as you think it's going to be. And in actual fact, it's yes, it is a grade 5. Yes, it is something that they can't stop. But you're not ever going beyond the natural anatomical barrier of the joint. So you're not going to harm the joint by doing it, because you're not forcing it where it shouldn't be. It's just you are trying to get back the very end of range of that joint, which is always, if you have a range of motion, which you will have in any joint, it's always going to be the very extremes of that range that are the first things to be lost. And that's basically what chiropractic is trying to do, is get back those extremes of range. Because although you may not actually go through the full ranges of motion on every single joint every single day, it's amazing the difference it makes to your normal functional ranges of movement when you do actually lose that end of range. It just alters the biomechanics of how you can move and how you can walk, whether you're whatever animal you happen to be. So it was really interesting and really reassuring once we learned more about it and understood actually what was happening. And in actual fact, it's hopefully, if I've got to practice still, and I've got to perfect my technique, and I shall probably aim to do some more work experience or shadowing or something if I'm able to, but it's definitely something that I think will help make me a better manual technician. So, yeah.
And so, would the difference therefore be fair to say that with physio you would still try to reach those ends of the extremes of the joint movements, but it's a much slower process to get there?
Yes, that's exactly it. And while that can be fine and can be very useful, it also could be more painful. So sometimes it's looking at if you've got a very stiff, painful joint, do you spend, as you would with a physio, 5 minutes or so trying to work that joint through range to regain the end of range, which can be quite uncomfortable, at least to start off with, or do you just do one short, sharp manipulation, adjustment, whatever you want to call it, which can be just as effective and is a fraction of a second rather than a couple of minutes. So yeah, there's also some differences. So there are still definitely going to be times where I'm going to mobilise as opposed to adjust, but there are definitely now times that I'm going to look at that I will adjust as opposed to mobilise. So the other thing that happens is that because it's a sharp, explosive movement, you get different nerve reactions within the joint. So you turn on the mechanoreceptors within the joint, which is a type of nerve which gives information to the muscles about moving. And that can in turn help with muscle health and joint health in a very complex physiological way, which is probably not anything to get into here. But so you might use it rather than just to regain range in a joint, and it is done to regain range in that joint, but you might also find that because that joint is a bit stiff, those muscles that are around that joint aren't switched on as much as they could be. So therefore that joint is more unstable than it should be, which can then cause pain. It may cause pain in that joint where it's stiff, or it may and unstable, or it may cause referred pain to somewhere else. And in actual fact, whereas excuse me, sorry, if you treat the pain, especially if it's referred pain, you may not actually be treating the primary problem, if you see what I mean.
Yeah.
So by treating the joint and removing the stiffness, you then have a knock-on effect to the muscles, and you then have a knock-on effect to the pain, hopefully. So, yeah.
Fantastic.
It's really, really interesting. It's something I need to get my head around a bit more and need to learn and practice more. But I do think, I can see how it can fit really, really nicely in what I'm already doing. And then also probably, hopefully, if I'm, as and when I get to the stage where I'm doing it as effectively as possible, will then make my other exercises and my other treatments more effective, because those muscles will be in a better neurological position to want to do what I'm asking of them, if you see what I mean.
Yeah, no, I do, and I think it's amazing because it it's like it's a big I don't know if development's the right word, but like for you to be sort of open to taking on something like this, which is a whole new type of thing. I think it's really cool. Like like we were saying the other day about kind of lifelong learning. I mean, that's pretty cool. The people that took the course, who are they? What do they do?
They were all other ACPAT physios that have all basically got to the same. They've practiced, they've mastered their skills at what they're doing at the moment, and wanted to add more. It's especially, it doesn't matter how experienced you get, you will always end up with one or two clients every now and again that, although they're improving, you just don't feel they're quite there, and you're not entirely sure what you're missing. And while I'll be using it on more than just those clients, but it's for those. It's like, what else do I not know? What else do I need to learn to help those clients as well as I can help the rest of my patients? And it's so that's why we were all there. We just wanted to learn about something different. And I don't know, I personally will definitely be incorporating it into my practice, I think, but I don't know whether everyone there will incorporate it into their practice. But at least we now know about it, and it's experience and knowledge, and that can only be a good thing as far as I'm concerned.
Yeah, fantastic. And who was actually instructing on the course?
So the instructor was a lady called Emma Fretwell, who is a human qualified chiropractor as well as an animal qualified chiropractor, and she's the head of the animal faculty of the Royal College of Chiropractors currently. But she was lovely. The reason she was doing it was because she works locally and in conjunction with the physio who organised the course, and it was precisely, the course was organised in the first place because that physio, as I said, it's those dogs that you can't quite get better, and if she then sent them to Emma and Emma was adjusting them and they were coming back better, and she was like, well, hold on a second, that's not on, I need to learn this too.
Is it generally quite I'm guessing that the number of veterinary chiropractors is smaller than veterinary physiotherapists?
I'm not entirely sure. I think it is slightly smaller, but it's equivalent. There's actually a lot more vets who are veterinary chiropractors, because there is there's a course in Germany that Emma and there was another guy teaching on the first day they're very involved in the teaching of it, and that's specifically for vets and already qualified chiropractors, human chiropractors, I think, as I understand it. So there's actually a fair few vets that do chiropractic, but I'm not entirely sure about the entire numbers. But I think there's a few more vet physios on the whole, but there's not a lot in it, I don't think.
Fair enough. And do they is it generally quite good? So do they get on well with each other? There's no kind of rivalry as such. Is it sort of quite a collaborative relationship, or between physios and chiropractors?
No, traditionally it's been really quite them and us. So this is quite a nice, refreshing attitude from both sides, to be honest. I mean, physios have been just as guilty of it as chiropractors have. But yeah, I think we're all starting to realise, or a lot of members of both professions are starting to realise, that it's only counterproductive not to share what we're doing. And in actual fact, when you actually sit down and talk to these, talk to the different professions, what we actually do has a massive overlap, but we have slightly different techniques and slightly different, areas of expertise. So, why not learn from each other, really?
Yeah, no, that makes sense. Makes sense. All right, cool. I'm going to let you go. I think, are you seeing some cases this afternoon, or?
Yes, I've got 3 cases to see this afternoon. So yeah, I will.
Cool. Well, I'll let you go. Thanks for telling us about the course, because I know on Friday there was a certain sense of I'm not quite sure what we're going to find.
Yeah.
Let's go with an open mind. So.
Yeah, no, I'm very, very glad I went with an open mind, and I'm very, very excited about it. So it's very cool.
Fantastic. So I guess you said you might be doing some more other parts of the body courses, and I guess we'll catch up on and all that in the future as well.
That's my hope, definitely. Yeah.
Cool. All right, great. Well, enjoy the rest of your day, and I'll speak to you soon.
Thank you. Okay, bye-bye.
Take care. Bye.